Okay, so we're going to talk about positioning of the patient and positioning of the operator. The very common position is sternal, like you can see here in this dog. This is a cadaver. So the positive side or positive benefits of that positioning is that you don't need to turn the patient during your procedures if you have to do both ears. I honestly try to do videootoscopy always on both and starting with a healthy one, but if you're expecting to do only one ear, you may not need this position. If you expect to do both, that might be helpful, especially if the time under anesthesia is critical. So in this position, when you go in the ear canal, you will see kind of like a normal anatomical positioning of the eardrum as you are accustomed to see with a normal endoscopy. So this cadaver has a little bit of hair, so I cannot see well the detail of the eardrum because of the hair. But anyway, the upper part will be dorsal, the lower part of the eardrum will be ventral, so you can see exactly how you normally see it in normal endoscopy. So the negative side of that positioning is that you need to use both hands, one for videootoscope and another one for holding the pinna, because you really need to constantly pull the pinna up, otherwise you cannot make the ear canal straight enough. So either somebody is going to help you with the pinna or somebody is going to help you with the instrument, because you need to deal with the tools inside of the channel, inside of the canal, but you don't have enough hands for that. So that's a negative side of that position. So another position is lateral, and in that position you can still be at the ventral side of the patient, so that will still provide you the most common for you view on the eardrum, because you're still going the same way, like the same anatomical way, like whatever is dorsal, it will be on the up of the screen, whatever is ventral will be on the ventral part. But again, the same issue, you need someone to hold the pinna, or you need to do it yourself, and someone will operate with the instruments, because you basically need two hands to do it. And now the same lateral position, but you are standing on the dorsal side of the patient. So in this way, everything which you are going to see on the screen will be upside down. So basically, you have a little bit weird way to go inside, because you might not be accustomed with this view, but whatever is on the top is actually ventral part of the ear canal. Whatever is on the bottom is actually dorsal part of the ear canal. The same with rostral and caudal. But in this way, what may be beneficial, first, you can hold the pinna with the same hand as you're holding videootoscope. So first you go inside and you need to hold it separately, but when you're already on the place, for example, you decided to use some tool right now, you can see I can hold the ear pinna with the same hand I'm holding my videootoscope. And then I have my hand free to manipulate with some instruments. So that's one benefit. Another benefit, if you look closer on this tip of the videootoscope, the operating opening is on the dorsal side of that videootoscope. So if you go this way like a normal, when you stay here, all the instruments will be pointing to the dorsal side of the eardrum, which is not very typical what you need. Most of the procedures you need to do on the ventral part of the eardrum. So that position may also help you, because you will be pointing, like again, like here, this is a ventral part of the eardrum, ear canal. This is a dorsal part. So your instrument will go on the top of that. So you will be pointing to the ventral part of the eardrum. So if you stay on that side, you will be pointing here, and you will need to put your videootoscope a little bit down, and you will not see much what you're doing, because you basically will be looking at the wall instead of the action which you are doing inside. That's all.